I hear a lot, doctors know that exercise fixes everything. Well, it's actually not necessary for weight loss and all that. So of course it's more complicated, but there's a lot of knowledge now, science saying that exercise is important for cancer treatments or prevention. What's the latest science on this?
Well, there's a lovely breadth of data looking at muscle and fat mass, lean mass versus, maybe even belly fat, et cetera. But they've actually done some imaging studies like CT scans and MRI scans and characterized the amount of lean mass or muscular. Like, what does the muscle look like? Is it this nice, solid piece of meat, or is it marbled with fat? Is it shriveled and marbled? Is it, how does that fat look in characteristics? And what they have found is the more robust your musculature, the better the outcome in the cancer patient. Regardless of, I shouldn't say regardless, but even if that patient was obese, if they had really good musculature, they did better. The worst combination is a lot of fat mass and very little muscle mass. And that's what we have come to term, sarcopenic obesity. Sarcopenia means muscle wasting, but the patient is still fat. And unfortunately, when you just look on the outside of a patient, you're really only seeing potentially the fat mass. You're not looking at the muscle density itself. So why might that be an issue? Well, interestingly, right, our muscles store glycogen, and glycogen is made up of sugar. So when we eat maybe a higher carbohydrate meal, and that is broken down into individual glucose molecules, et cetera, then we're going to store that glucose into our muscle glycogen. And if we don't have very much muscle, we have less storage for that glucose. In addition, when we are moving and doing exercise, we're using up that glycogen, creating more space for the next load of glucose, which can then just kind of flow in, less insulin. You don't need insulin kind of in that setting. The muscle becomes a sink for glucose. So if we can build lean mass, and we just talked about how a ketogenic diet can build lean mass, we now have more glucose, operating tissue, which improves insulin sensitivity and decreases, right, that insulin being up all the time. When we use other exercise techniques, so maybe it's high intensity exercise, because there is randomized data looking at kind of steady state cardio versus high intensity interval training. So you're kind of working really hard, getting into that kind of lactic acid burn, and then you're recovering and you're up and you're down and you're up and you're down, that actually has a dramatic insulin lowering effect on a patient's health. So we can kind of do chronic steady state cardio. And I think that that's exactly why the whole move more doesn't work in weight loss, because it's really not changing insulin. And really weight loss is insulin reduction, allow that fat to flow out of your cells instead of constantly pushing into your cells. Insulin is a storage hormone.
Has this, so we talk a lot about associations versus causations. And as a clinical trialist, I like to focus on clinical trials going forward in time, especially if you randomize, have an experiment going on to really isolate one factor. Do we know the relative potency or the strength, so that if I was going to advise one of my patients, well, here's what you need to do to prevent and even treat this cancer, you need to do a keto diet and exercise. Which is how much exercise? I know how much keto diet to give someone a dose of exercise, and I think of it as dosing. How many grams of carbs is like a dose. The lower you go, the higher the dose. More exercise, hours per week, or what's the relative benefit? And I know it can be hard to figure out, because if you're just looking at associations and now trying to figure out prospectively, sometimes we're fooled into thinking it's more important or less important than we thought.
Yeah, unfortunately, in a cancer world, that's really hard to know, because cancer patients, you'd have to follow them for so long before we start to, right? I mean, our cancer trial follow-ups are 5, 10, 15, 20 years, because we're waiting for that potential recurrence to happen. And those recurrences don't happen in 6 months or a year, typically. But what we do know from a quality of life perspective, so that's been done a lot, where exercise decreases fatigue associated with cancers. I would say that there is some with, again, back to improving quality of life. There's a nice study out in prostate cancer patients using a ketogenic diet and just walking, actually, but those were patients that you're very well familiar with, that group that had androgen deprivation therapy, right? They were on hormonal therapy for their prostate cancer, which typically decreases bone mineral density, and we improved bone mineral density in those folks, or they maintained better than the group that wasn't using those techniques. So I think that from a cancer outcomes, we may never know, but I think that we know so much about insulin. We know so much about those drivers. So again, can I say, hey, if you lower your insulin, we know that there is significant improvement in outcomes in patients with lower insulins compared to patients with higher insulins. And I think we just have to continue to build upon what we know. And I don't know if we can ever get to that unless we used, unfortunately, those stage 4 maybe, or more aggressive cancers that we would expect earlier recurrences. But, they may be almost too debilitated to do some of those things.
Well, so there's a common sense to me that when if you are preparing for something that's very difficult, so like we learned in the COVID era, that if you were going to be seriously ill with COVID and you had diabetes and obesity and hypertension and all these chronic medical problems, you had worse outcomes with this disease. And I have to think the common sense, if you're going to have to go through a chemotherapy regimen and radiation, and so if there's a cancer predilection in your family, then you're going to want to be in the best shape you can be now preventatively, just in case you're going to have to go through that, even if this approach doesn't totally prevent it. I mean, what if it is the plastic in the bottle that caused it and you didn't reduce the cause? I think you want to be in the best shape you can be, just because you may undergo a difficult treatment.
Absolutely. And so I do have some patients who do take a step back. Instead of jumping right into chemotherapy, they do take a month to optimize their diet and their exercise and things to prepare for this upcoming, big surgery or big chemotherapy or whatever they're going to do. They want to optimize that potential outcome and how they're going to feel while they're going through it.
So sometimes there isn't an urgency to get the traditional treatments. I guess that would be dependent on the person.
100%. Yeah.
So big themes. I don't, just so that people know, we're not saying that a keto diet can cure cancer. That's not been shown yet, but certainly it can be helpful in all these other ways, right?
100%. Yeah.
This video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.